Welcome. Sago, Scano, hello everyone. Lori Davis Hill here, Director of Health Services and Incident Command for Pandemic Response on Six Nations of the Grand River. Today is Thursday, May 28th, and this is your Six Nations COVID-19 update. To get things underway, I want to touch on a topic on everyone's mind as things start to reopen. This is worker risk to exposure of COVID-19, and the source of this information is www.Ontario.ca. Regular workplace assessments are important to occupational health and safety. While employers are ultimately responsible for protecting workers, joint health and safety committees or health and safety representatives can also identify workplace hazards, such as products being used, chemicals or hazardous substances, processes that can happen, such as working with particular tools or tasks, and at present, COVID-19 is a hazard for everyone. After a hazard is identified, health and safety representatives can make recommendations to the employer on how to control workers' exposures to it. A risk assessment can help the employer determine whether source control could be helpful for workers. When certain substances or processes are determined to be a risk to a worker's health, the risk can be controlled in many ways. Risk among workers will vary by their ability to physically distance and other controls available, for example, physical barriers. Risk looks at contact with the public and co-workers to identify exposure risk. Where workers are not able to practice physical distancing or they have frequent contact with the public, masking could be considered for source control. The hierarchy of controls is a set of practices an employer can consider to protect workers from exposure. The controls are considered in order from most effective and protective to the least effective and protective. A comprehensive strategy to reduce the risk of COVID-19 transmission in the workplace would include as many controls as possible. First of all, engineering. You can remove or block the hazard at the source. That would be physical distancing, physical barriers such as plexiglass roofs, or frequent environment cleaning and disinfection. Administrative controls means optimizing the movement of workers to minimize potential contact with the hazard. That could be scheduled staggered shifts, breaks and meals, workstation spacing, work from home policies, limited hours, staff reductions, virtual meetings, paid sick leave, temperature screening, symptom screening, and reporting. Next are personal hygiene controls, worker actions or behaviors that reduce hazard exposure, cleaning your hands, coughing or sneezing into the sleeve or elbow, and masking for source control. Personal protective equipment or PPE controls include masks, gloves, eye protection, gowns, or coveralls. Masking for source control, which means I'm not giving the virus to you, could be considered a personal hygiene measure, and it protects others, but not necessarily the masked worker. If implementing masking for source control, please note the following. Masks are to be changed if visibly soiled, damaged, or difficult to breathe through. For non-medical masks, no specific type of material is clearly better than another. Breathability, comfort, and safety, that is adequate vision and communication, are also key to compliance. The Public Health Agency of Canada has provided guidance on how to make, use, and care for cloth masks, and that could be used as a guide. You can see these guides and specific guides to Six Nations on our Six Nations COVID-19.ca website. You can also refer to the Ministry of Health website for more information. Let's now see what our numbers are saying today. We are seeing a drop in the overall numbers in the province over the past 2 days, with yesterday having 388 overall new cases in Ontario. Well, at Six Nations, we say today with a total of 13 cases of COVID-19 having been reported. And breaking things down, we now have 2 active cases, and of that total account, we have 10 that are considered resolved, and to date we continue to report 1 death in our total case count. By testing, we have conducted 726 total tests. 647 results have shown negative results. 66 test results are outstanding. We now have 108 people in self-isolation under the direction of Oswego Public Health. In adjacent and surrounding communities, Mississaugas of the Credit remain reporting 1 positive case. Haldimand Norfolk Public Health Unit does not have confirmed cases available today. Brant Public Health Unit has 108 positive cases, 94 resolved, and 4 deaths. Hamilton Public Health Unit reporting 661 cases, 436 resolved and 34 deaths. And Toronto Public Health is reporting 10,525 positive cases, 7,814 are resolved, with a total of 780 deaths to date. The heat wave is still active and is looking to lift by Friday or Saturday, but to remember to watch for symptoms of heat illness, which include dizziness or fainting, nausea or vomiting, headache, rapid breathing and heartbeat, extreme thirst, decreased urination with unusually dark yellow urine, changes of behavior in children like sleepiness or temper tantrums. If you or any of your family have those symptoms during extreme heat, try to move to a cool place and drink liquids right away. Water is your best bet. If you have to assist someone with heat illness, try to cool the person right away by moving them to a cool place, applying cool water to areas of their skin or clothing, and providing fanning to cool the surface of their skin. Earlier on in the week, we announced that testing is now available to everyone. If you want to test, we are here to help you with that. Simply call the Six Nations COVID-19 Assessment Center, and that one simple step starts your test process, and you simply have to schedule an appointment. The COVID-19 hotline is open 7 days a week to take your calls. Please get tested, even if you have the simplest or mildest of symptoms. The Six Nations COVID-19 Assessment Center can be reached at 226-446-9909 or toll free at 1-855-977-7737. Plain and simple, early detection allows us to stop the spread. Let's all work together to keep Six Nations COVID clear. Continue to wear a mask in public, keep physical distancing, wash your hands frequently, and clean high-touch areas often. I will wear a mask to protect you. Will you wear a mask to protect me and your family? Join us tomorrow for our speech-language pathology guests in honor of May as Speech and Hearing Month. And we close with some more announcements. It is Paramedic Services Week. Remember to watch social media for posts from our paramedic services about how they protect themselves so they can protect you during the course of this pandemic. The Six Nations COVID Relief Fund, used to purchase much-needed personal protective equipment and medical supplies and equipment to maintain pandemic operations, as well as food and necessities for community members who are facing financial challenges. The fund is being administered by the Royal Bank of Canada, and contributions can be made through electronic funds transfer and at the email covidrelief@sixnations.ca. Public Works continues to call for homemade masks. Any and all donations are greatly appreciated, and for more information, you can call 519-445-42. And if you are struggling and would like to connect with Six Nations Wild Service, you can do so by phone, 866-445-2204 or 519-445-2204, and that's available 24/7. You can contact them by text Monday to Friday, 8:30 to 4 at 226-777-9480, or by live chat on the Six Nations COVID-19.ca website, Monday to Friday, 8:30 to 4 p.m. Remember, our frontline workers are working to do their best here on Six Nations and around the world. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyawa.